Right, let's look briefly at rotator cuff tears. Remember, the rotator cuff is comprised of the supraspinatus, the infraspinatus, the teres minor, and the subscapularis muscle group. The function of these muscles is basically to create a dynamic stabilization to the glenoid fossa or the glenohumeral joint. This joint is made of the glenoid fossa, which is very shallow and small relative to the humeral head. So all of these muscles contracting create a compressive load that kind of keeps the glenoid fossa and humeral head in contact, if you will. They attach on the front, top, and rear of the humeral head, and they're vital when you're using other larger, powerful muscles to move the humerus through a wide range of motion. The rotator cuff is frequently injured, and the supraspinatus muscle, which is a muscle on the top, on the supraspinous fossa, is the most common, followed by the infraspinatus, and it's often through overuse in overhead or reaching motions. So this can be through sport or through workplace scenarios. So let's look at these rotator cuff tears. Usually it comes from a subacromial impingement. So remember, here is your acromion fossa. This is your humeral head and your glenoid fossa. We need this space, subacromium, to be large enough so you can have nice ranges of motion of your humeral head on your glenoid fossa. Overhead reaching with poor mechanics can cause this humeral head to translate upwards, kind of impinging this tendon, and you can imagine constant rubbing on a tendon between bone and bone may contribute to weakening of the supraspinous tendon and an eventual tear. So here's poor mechanics. Here's your chromium process and your humeral head. This is basically limited space. And as your supraspinatus activates, it kind of pulls that tendon through a very small space. What we need here is some inferior slide to pull that humeral head down. And that usually is when the subscapularis is co-activating during this motion, kind of creating this downward slide to keep the humeral head and the glenoid fossa in proximity, but doing their arthrokinematics in the proper fashion. If this occurs on the left, it will result in something like this, where you could have a supraspinatus tear, which can't feel good.